Welcome to the webinar hosted by the 21st Century China Center at UC San Diego's School of Global Policy and Strategy. We are a university-based think tank that produces scholarly research and informs policy discussions on China and the US-China relations. My name is Victor Shih. I'm the Homu Alum Chair, Associate Professor in China and Pacific Relations, and teach here at the School of Global Policy and Strategy. Thank you for joining our discussion today. Our webinar is recorded and will be available on video and podcasts, which can be accessed on our website, china.ucsd.edu. And also, our forthcoming events, programs, and some of our research is also available on that website. Please use the Q&A function on the bottom of your screen to submit your questions. I'll be reading the questions you submit for our speaker during the Q&A time at the end of the presentation. Today, we're very delighted to have Professor Scott Rozelle with us today from Stanford University. Scott is the Helen F. Farnsworth Senior Fellow and the co-director of the Rural Education Action Program, or REAP, in the Freeman Spogli Institute for International Studies at Stanford University. He received his bachelor's from the University of California, Berkeley, and his master's and PhD from Cornell University. He is the most published China scholar in the world, with hundreds and hundreds of publications on agricultural policies, including supply, demand, trade in agricultural products, the emergence and evolution of markets and economic institutions in the transition process and their implications for equity and efficiency, the economics of poverty and inequality with emphasis on rural education, health, and science. This is his more recent work focuses on that. As one of the titles of his article suggests, which is entitled Working Until You Drop, if any one of us were to try to produce this many articles, we would drop pretty soon after that. But of course, today we're very happy to have him and with us today to talk about his finding after the onset of the COVID-19 in rural China, where of course he's got many fingers on the ground, really assessing the pulse of rural China during the coronavirus. So we're very happy to have him talk to us about this today.
That, and that, and that. Good. Okay. Great. Thank you, Victor and Samuel and colleagues. It's my pleasure to be able to share with you today. It's with some sort of regret that I'm not staying down there in San Diego and doing this face-to-face with everyone. We have 6 generations that have been born in Southern California in my family, and I've spent a lot of time in San Diego. So it's, but up in the Bay Area, it's beautiful. So it's nice to be able to share by Zoom. I'm gonna talk today about, off the epicenter. So we're not gonna talk about Hubei. We won't talk about Wuhan. But of course, most of China wasn't inside Wuhan, right? And we want to really examine the impacts on China's 600 million. I should say the PI of our whole set of projects that we're going to be continuing to follow the story about rural China and COVID-19 is run by Huan Wang. She's a research scholar at Stanford, and she did most of this, the empirical work there that I'll show you. Okay, so what are we gonna do, right? Everybody knows the story, right? January 25th, night before New Year's, right? let's shut down China, that were all public spaces, business schools are shut down, rollout. That it happened that the rollout of these measures happened right at Chinese Lunar New Year, when literally 300 million or more people had just went back to their home villages to celebrate New Year's, right? So the migrant communities have emptied out, and everybody's back home to, you know, light fireworks and have dumplings, right? And then it happens the night before that they shut it down. By mid-March, 5 weeks later, you know, the cracks are starting to open on the quarantine, and outside of Hubei, right? They just let the kids go back to school in Wuhan today. Sort of, it's another milestone in that. Most of the coverage of the quarantine, of course, focused on Wuhan, focused on the health impacts, and at the very most people saw the empty avenues, shuttered businesses, empty factory floors of urban China. You know, and then, but really almost nothing is known about how the quarantine affected most of China's people, right? The 700 million rural residents that are sort of outside the epicenter. And a large share of these, 288, were migrant workers. And there's about 100 million, you know, bigger than the labor force of the US, 100 million that were living at home and working off the farm. They call it zao chu wan gui. So you leave the house in the morning, you come back at night. So what's been the impact on them? So, you know, there's some really reasons we need to figure this out. It's a big part of the economy. It's been a driver of the economy. If anybody knows my work of recent, I'm worried it's going to be a drag on the economy in the coming years. Certainly, you know, not yet, but we're worried about that. Rural China has a very, very low safety net. There's no unemployment insurance. There's no furloughs. There's almost no emergency payments. There's no $1,200 checks that you're waiting for from the IRS. And almost all of everyone that went back, those are all paid on a per day, per month basis. That means if they're not working, they're not being paid. So this makes them very different than the urban population who sit at home, and you know, the professors at Stanford and UC San Diego that sit at home and write papers and Zoom and we collect our salary, right? That's not rural Chinese workers. And so their experience may be important as this COVID virus has moved to other vulnerable populations, rural populations, India, Nigeria, et cetera, et cetera. So we'll see how many lessons there are, what we can learn for that. Okay, so what are we gonna do? I'm gonna do today 3 big things. What happened out there? What were those disease control measures? Number 1. Number 2, did they help with the virus, right? Did clamping down like this, did it really hold the infection down? There's, as you know, if you listen to any news, there's lots of skepticism about, you know, what the virus was like really in China. How many people really were there? How many people really died? Is China underreporting those numbers? I'm not going to be able to give that number for China. I think we have a good snapshot of rural China that I, you know, mostly believe. I think that they're within a standard deviation or so. And as you're going to see what we'll see that part in the second part of the seminar. And the last one, we're really going to look at what's the cost. So this is going to be the benefit of doing it, and what are the costs of doing this, and, you know, in terms of employment, income, schooling, healthcare services, et cetera. And this is healthcare service beyond COVID-19. Okay, so where are we going to look at this at? Okay, here it's the orange provinces. Hubei, Wuhan is here. So we're going to be looking at this circle of rural economies. Some of them are 1,000 kilometers away. Some of them are across the border, okay, over here. And there's 726 villages in these areas, basically 100 per province, más or menos. And what happened was over the last 3 years, we've done other projects in Gansu, Ningxia, Shanxi, Sichuan, Yunnan, Henan, and Jiangxi, 7 other projects. And we chose very large samples across, it's across 82 different counties in these, so 10 counties per project. And what we end up doing is randomly choosing one informant from the original survey to then to serve as a village informant, okay? And we did this survey in February 24th, exactly 1 month after the shutdown of the economy. And then we did it again in March 24th, okay? And we did it again in April 24th. And this is not included today. We just got the data back about 3 days ago, and it's be coming soon, okay? And we're actually planning on skipping a month and going back June 24th, and try to really understand the longer run impact. This is the survey. Here's our enumerator. You know, REAP, our group, has collaborators in every single Western Central province. Here's somebody in Henan University in the School of Education. She's from Kaifeng. This is Kaifeng beautiful apartment buildings. And she's calling this farmer out in a remote county in somewhere in Henan. Okay, so that's how it was done. He was asked 39 questions, okay? And they're about the control measures, the infections, and impacts on employment and income, education, and then generally for the village. It took about 30 minutes or so. And then we asked question 40, okay? We asked question 40, which was, what else do you want to tell us? Now, you got to realize, right? Look at this man here is been sitting inside his house with his 2 children and his wife and father for the last 30 days, and he's really bored. He will not get off the phone. He's really enjoying talking to us. And when we ask him that question, he vents. He vents about how angry he is. He vents about how he doesn't understand. He vents, and or he's talking about what he wants to do if he ever gets out, and ask her what's her opinion. It's our enumerators after halfway through say, do we have to ask question 40? You know, but they're really very communicative. I'll talk a little more about the quality of the data in a second. So what did the survey tell us? Okay, what were the COVID-19 control measures, right? That's the first thing we ask. And, you know, there is very little drama here. It's villagers were not permitted to leave the village. Visits were not permitted from outside the village. Weddings and funerals were not permitted. They weren't permitted to visit other homes within the village. So there was more controls on going between households. So if, you know, your uncle lived over there and you were here, you weren't allowed to go and see them. They weren't allowed to go for walks. So, you know, this is no exercising, not even if you have a dog, right? And then the last one is, this was the hardest one. We do a lot of work on education. We're writing several papers on education now, but the children weren't permitted to go outside for almost 2 months. You can see, and these aren't big, beautiful San Diego beachfront properties, right? Now the houses typically aren't bad, but they're still cement floor, blank walls, and you know, there's very few toys or et cetera in there. Okay, and so these are very strict, and there was really high compliance. And this is how they comply, right? So, you know, you've seen these all around here. We have one, we asked the villagers if they had any photos, and they sent us, we got a whole catalog of them. You know, there's one village that they dug a trench across it was a dirt road coming in. They dug a trench there. It looked like a moat, right? Like in a castle. And so, you know, this kept people out, right? And kept people in, right? And by mid-March, though, look at the, villagers were permitted. You can see very quick this reopening. Couldn't have weddings or funerals. You weren't permitted to have big gatherings, right? But now you could move in and out of the villages mostly, right? I would say mostly because 17% of the villages, 17% of 800,000, that's only 150,000 villages where they still can't, now, but 650,000 they can, right? And by March. So you see this opening up, right? And you have to wear masks, right? I mean, the only problem with that is that there were no surgical masks in these villages. And so very few people were allowed to go out. Village leaders were very, very busy buying groceries for villagers that couldn't go out, or villagers would share masks or make them. So you can just see that this is much more strict than South Carolina and Georgia, right? It's much more strict than Northern California. So, okay, and even as the restriction, this is taken about 2 weeks ago in one of the mountainous villages in Sichuan. We just had a spring snowstorm, and they're still taking temperatures of people coming in and out of the villages, right? So this continues today. They can go in and out, but they need to take a temperature. During how did they do this? You needed a passport, right? You needed this little passport. This reminds you of, the Cultural Revolution, or at least the early 80s. And if you were migrated out, you had to have a migration permit. So this is, and what the villagers will say, every village, every half mile, you would run into an inspection station that would be looking at this as you try to get to town to buy groceries or something like that. Okay, so that's what happened. That's the first thing. What's the infection rate in these villages? Here's the good news, okay? This has been picked up by the Chinese press, and undoubtedly they talk about this part of the paper and the survey. The implied infection rate was per million population. There were about 1 million people in our village. 700,000, right? So 750,000 people in these 730 villages. There was about 10 cases per million, maybe 12 cases per million, okay? 0.01%, really, really low. No community, nobody ever transmitted a virus from one person to another except within a family, okay? And that happened in 2 of the villages. And once they were taken, they were isolated and treated in designated hospitals, and no one in any surveyed village reported deaths, okay? So 0 deaths. And so this is 10 cases per million. China overall was 60 cases per. Hubei was 1,000, and California is 1,000. The U.S. is already 3,000. Yeah, we're doing pretty good in cases per 1,000. So these villages look just like the rest of China outside Hubei. Okay, and remember, this is what everybody's saying. China's lying. I cannot vouch for this number, 12 per million outside of this. What we can say is we are fairly confident. And the reason is, right, because people ask us all this time, were they really this low? Can you believe these guys? If you spent any time working in villages in China or anywhere in the world, news travels fast, right? Especially every single person has a cell phone, right? I mean, everybody's related to one another. If there was an infection present, the village informant would know. And do you know why they know? Look at that. This isn't even somebody infected. This says this household had somebody who returned from Wuhan. Do not come near here. Right? Exactly. I mean, and these are all, when there was anybody that came back from Wuhan, this went up. if the person had an infection, they would do a double cross and then haul the person away to the county hospital. Okay, and so people are going to notice that, and they're going to know that. Also, I find if somebody has done a lot of rural surveys, that rural people will, basically, they'll basically tell you the truth. They have it's hard to get them to lie, and I've done lots of surveys on time, so they could have done there. But the other thing is, remember, is they're ordinary villagers. These aren't, if the randomly selected person was a village official, we said, "Oh, how you doing? We're gonna go pick another village." Hung up on him because we didn't want to get a party secretary or a village. If it was a village doctor, we didn't talk to him either. We wanted to try to have as objective view as possible. The low infection rate in our sample, perhaps because it happened fairly early, and then they shut it completely down. You saw they shut it down. And 90% of migration from the epicenter of Wuhan was to Hubei, right? So only 30% was, now 30% of the migrant population was a lot, but 10% of the whole population, or 30% of the non-Hubei population, went to one place, Wenzhou, southern Zhejiang, right? And so the rest of, there's still a lot, but they went that, right? They, one person came here and two people came here and three people came there. And, there's 800,000 villages, right? And so, it's not, the infection rates in Wuhan villages were much higher, okay? And so, did it limit the disease? March, April, no cases reported. Okay, it was total of 10 over this entire period. We don't have the counterfactual, right? Like the that's the whole problem the whole problem we're going to be facing, with our own pandemic, right? What would have happened if we would have clamped down earlier? What would have happened if we hadn't have clamped down at all, right? You only get one shot at it, right? And so we don't know exactly what the impact of cracking down is, because this is the first and only pandemic we've been through. Given the nature of infections in other countries, it probably helped. So I think it's good news. If you want to shut down your entire economy and let no one leave the house, you'll probably reduce infections quite fast. Okay, 6 weeks and it's gone. We would be virus-free in the United States if we did the same thing. Okay. So that was all the good news. Okay, now let's go to the bad news. What's the impact on employment? In February, end of February, employment is 0. Okay, and by the full months, basically, they said, "Why aren't you at work in late February?" My workplace is closed. If my workplace was open, I still can't get there because public transportation is closed, right? I can't even, if I have a car, they won't even let me drive, okay? And then let's say I could drive, or there's public transportation and my workplace was open, I couldn't rent a place in the city, that the landlords weren't renting. And very interestingly, and this is still an impact today, is there's a huge fear of infection in China. And many villagers said, "I don't want to go due to fear of infection." In this last survey we did, we're actually finding some very interesting, item number 6, reason number 6. And basically, reason number 6 is that moms want to go back to work, but their kids aren't in school, so mom has to stay with the kids to help them with school. I'll address that a little later. So there's lots and lots of reasons. But by March, right, it's all over. Everybody go back to work. 65% of the people, 66% of the people can't go back to work. 2/3, right? So that's so rural labor force, of the total labor force of rural is over half. Let's say half to make it easy to, the the unemployment rate of the rural labor force is 66%, of the whole labor force must be 33%, right? So that's if there's no unemployment in the city, which there is. So it's probably way over 40% in March. And by April, it's not increasing very much more. Yeah, yes, 12% of the people have gone back to work, 12 percentage points, right? But still over half of them aren't working. And it's for those same reasons as my workplace isn't open. I'm afraid to go. It's going to be hard for me to rent there, et cetera, et cetera. But so this is a lingering problem, right? That recovery of these rural informal workers is slow and will be slow, right? And other countries should think about that, right? Okay, so the decline in income has been significant. So if you aren't working, your income's going to go down, like duh, right? And it's gone down per month between $2,000 to $5,000 per month, right? It's already fallen about 15 to 20% of annual average per capita income by March, right? 2 months, right? 1/6 of the year, and so there's a real a problem there. Many people get their bonus when they go back. There was a lot of these people were ranting, and when they were talking about question number 40, they were ranting and raving about not getting their bonus. Okay, and then the former employer wouldn't answer their telephone calls, of course. So how have they been coping with this? This is what's interesting now, right? Is rural China is not India, and it's not Bangladesh, and it's not Nigeria. It's a Xi Jinping has eliminated poverty. And in most of these villages, there's very little formal poverty below the $1, $2 a day line. Okay. But they're almost all low income. Now, low income, but I've been low income for 20 years, right? I've got savings, and a lot of people do have savings, but a lot of people don't. Okay. And I think that's what we need to start thinking about. China needs to start thinking about. After March, there was half of the people reduced nutrition. 10% of the people were borrowing money from relatives and friends. 10% of the people were reducing education. 10% of the people were reducing health care. And most is to elderly who have diabetes, who have heart problems, who have strokes, that they just don't go. And so of course, here comes the great China government to the rescue, except unemployment insurance was zero. Okay, there were no transfers from the central government to the rural areas at all. 17% of villages said there was a relief program, and over half of it was to give food staples. So, there was a safety net. It's very, very low. Okay. And if a family really didn't have money to eat, there is a Communist Party there who can find some food to give to them, but it's very, very low safety net. So even for families who received it, right, it wasn't a $1,200 check, right? And everybody believes it's a one-time only thing. I said, so how else did they respond to this? Sorry, I said this too soon. They borrowed money from friends and relatives because they couldn't get a loan from the bank, and they didn't want to sell assets, or there was no buyers for their assets. So they couldn't sell their car, or they couldn't sell their tractor, or they couldn't sell their cow, but they couldn't get, so they're coping in all different kinds of ways, right? Trying to get through this. And again, it's only 10%, right? It's 60 million people, right? So 60 million people with their families. So it's probably 150 to 200 million people are living in families that are reducing nutrition, education, and healthcare right now. Okay. So what about education? We're very interested in education. We had run a big baseline in December, getting ready to launch a big experiment in March 1st when schools opened. Well, they were all closed in February. They were all closed in March. And by April, 25% of the schools had opened. It's getting way over half, probably 3/4 now are open after this May labor holiday. Therefore, most rural children have at least 2 months, many of them more than 2 months. And there's good news, okay? I mean, this is what's amazing, right? I mean, Huawei 4G, or 2G or 3G. That's not Huawei, but there is mobile connections to most villages in China. And you can see schools took advantage of that. By March, 87% of them had organized online courses. I mean, these are remote villages with dirt roads to them, and they're getting online courses. Teachers assign homework daily, okay? Teachers correct homework daily. They correct more homework than they assign. I don't quite get that. But, now, you got to understand is the teacher sends a note, says, take this homework assignment, print it out on your printer, and then have the kid do it, then take a picture and send it by WeChat. The problem is less than 1% of the families had a printer. So the mother had to sit there and copy the homework and then give it to the kid who then did the assignment, and they took a picture and sent it in. So there's a lot of work going on here, right? So that's amazing, right? That this many people are in villages where they're trying to do it. The problem is they're only trying. Because over half of the villages, all they do is they put some local urban teacher on the TV, and he or she gives the lesson of the day. And of course, they're pointed at their urban students, and they're teaching very, very fast. And the kids are watching online, and there's question and answer, right? But this isn't even the rural teacher, right? In rural schools, in urban schools, there's one math class, one Chinese class, one English class, one art class, one science class every day. In rural schools, there's one math class and one art class. Oh, cancel the art class. Let's teach math twice. Then there's a Chinese class, and then there's a PE class. Oh, let's cancel PE and teach language twice, because the kids take longer to learn. That's not what happened here. Students can see their teacher. Sometimes it's a blank screen, right? But the teacher can't see the students. It's just like our seminar. The great audience out there, I can't see you, right? And but that's like trying to teach 10-year-olds, and you can't see them. Most of them couldn't see them. And most people were studying on a cell phone. Look at that. And most people had to go outside, or 30% of the people had to go. They weren't allowed to go outside, but they had to go outside to get a signal. Okay. And so it's winter, right? And so this, teachers were unable to correspond with these. So look at that. 80% of the people had difficulty with internet. So although efforts have been made across China to mitigate the disruption, I think there's big negative effects on student learning, and the gap between rural and urban. Maybe urban, let's say urban went down a little because of the learning there, but rural probably went way down. Okay. More research is needed, and we're going to try to do that. This is the last part of it, the impact on healthcare. Hey, they could see a doctor. The hospitals were open, okay, because there's no COVID-19 patients in there, that they were more than happy to have patients come in. The problem, of course, is that lots of times it was a demand problem. The families didn't have any money to go. Okay, so just to summarize, virtually university compliance, infection rate was very, very low, right? That's the good news. Radical drop off in rural employment. We estimate in month 1, by February 24th, the rural economy had lost $100 billion in lost wages. In end of April, it's now $220 billion. Now that's just lost rural wages. The SARS virus. There's a paper that's criticized by everyone in the whole field that said the SARS virus caused damage to the world that was equal to $80 billion. To the whole world's impact and China, I mean, in rural China alone, it's 220 billion and growing. And of course, widespread deception. Yeah, my colleague, Dr. Wang, really wants to talk about what are the lessons for the rest of the world, for Mexico across. There are these massive restrictions in testing. There was sufficient testing by mid-February, right? Once hotspots were identified, there was quarantines, but it's very, very high impact, right? Unskilled lower income populations are going to bear the brunt, right? I mean, we saw all those professionals sitting in, they were our colleagues sitting in apartments in suburbs of Beijing, working away, earning, their full salary. But even among this lower income population, there's vulnerable subgroups. That's the challenge. Who's really in India today? Some of the most hard hit villages, because they've lost their supply chains, they're inundated with cheap vegetables and meat and grain. But there's other ones that had a flood or a drought, and now the traders can't go. So we got to identify these subgroups, and low skill workers are going to be very slow. When are they going to, we're going to work a lot more in education. We think that, China probably could deliver more ed tech applications to rural people than anywhere in the world, but they didn't do very well in these villages. So we're going to go. So I'm going to quit right there. Couple minutes over, sorry. But I'm really looking forward to have some interaction, and there's lots going on here.
Thank you, Scott. Excellent presentation as always. Learned a great deal. Even when you're watching Bloomberg or something like that, that's the best source of information. You're only getting data on urban China, and for most of us, at least, we know nothing about what's actually happening in rural China, and so you really provide a very valuable glimpse for us. So lots of questions. I'll just kick out a couple of my own. The first question is, and this is also someone in the audience also asked the same question, like, what do you think is the role for the timing of the Chinese New Year, Lunar New Year this year, right? So the fact that most of the migrant workers had returned home already by the time the lockdown order was issued, did it help limit the spread of the coronavirus or exacerbated it? My second question is, did you ask question, especially in the March and April round, in terms of how many migrant workers had to then return home to rural China because of loss of employment in urban China? That caused an additional reduction in average nutrient intake, food intake, right? So I thought that was the most shocking result that, of your survey. So if you can comment on those two issues.
Yeah, there's a couple of issues around the timing. So some people have asked me, did they purposely wait until Lunar New Year and everybody was home so we'd clear out? Yeah, I think that probably wasn't. I think that it just happened to be, right? That it happened. Yeah, so what would have happened if it had happened in December 15th, right? The same amount, and then they would have, it probably would have reduced the spread out of Wuhan, right? I mean, I think for sure, right? I mean, there's still people coming and going, right? But it's not, what is it? 200 million divided by 10, by 20. Yeah, it's probably 10 million workers in Hubei in that area. So 10 million. Now, what really caused probably the biggest impact is the, I don't know, 500,000 Wuhan rich urban people who got on planes and went on vacation all over the world, right? And obviously our Santa Clara County here and the very Orange County, very early cases were all Wuhan vacationers, right? And now, you know, there was a long incubation period before it blew up, but, you know, but yeah, so did 500,000 people leaving at the same time? That probably has had a big impact on the global pandemic. And I don't think that was planned though. Could there have been better action earlier? Yes. Could we have had early action earlier? Yes, much earlier, right? So yeah. Second question was,
did any migrant workers from urban China go back to rural areas?
oh yeah. That's interesting. We haven't asked it that way, and I'm glad you did, because in our next one we will. We added a couple questions this last in April, was how many students who were attending private migrant schools in cities went back with their parents home, okay, and then couldn't go back to the city, and their schools weren't open anyhow, but they couldn't go to rural schools because they weren't registered. Wow. So we find about almost 10% of the kids in these villages had zero education, had zero schooling, because they weren't signed up and the teachers didn't know them. And so, so you're asking the same thing with workers, right? No, I don't know how many went and came back. There are definitely people coming back without jobs, and they're having those jobs is going to be a big problem. And certainly, if you've seen any of the WeChat or WhatsApp, WeChat ones get censored pretty quick, but WhatsApp or other comments coming out of these export zones, there's zero people working. And so, I mean, I think these unemployment effects are going to be long lasting. And of course, can be vicious circles down, right?
So a couple of questions from my colleague Guang Lei here. So one is, why did you not include Hubei villages in your sample? And then his second question is, you know, even though these medical facilities in the villages were open, what was their quality, and do you think that affected the mortality rate, you know, condition on people contracting the coronavirus?
Okay. So I told you how we selected our sample. We selected our sample because over the last 3 years, we had large scale surveys that we'd done there. So we already had a random sampling frame in these areas, right? And it covered, like I said, more than 80 counties in 7 provinces. And it let us get a nice, over the past, I don't think the last survey we did in Hubei was probably 2011. So we didn't have a sampling frame in Hubei. You just can't pick up the phone and call people, right? So we were picking up the phone and calling. We said, "Hey, do you remember that project where we gave your kid free glasses? Or do you remember that kid, where we gave your kid a reading test?" And the parents would all, he took a survey form home and you filled it out then. He goes, "Oh, that's where you got my phone number." And et cetera, right? So, and we'd always get an introduction from the teacher or from from someone. So that's why our response rate was, I think 7 people out of 730 didn't answer our call. And so the response rate was very, very high. So we weren't in Hubei. The second part of that question shows you.
The medical facilities.
Well, I mean, since nobody had coronavirus, nobody needed care. I mean, 10 people, right? If you want me to come back and give a seminar on the quality of healthcare in rural China, I'll be happy to. We've done a lot of work on this, and basically the answer is, expenditures on healthcare have gone like this. People going to hospitals and going to using health facilities has gone like this, and healthcare outcomes have gone flat. And one reason is the quality of healthcare in rural China is very, very poor. I don't want to go into too much detail. What we do is we do large scale randomized surveys where we take a patient, he's a local teacher, we train him to be a patient with angina or diarrhea or tuberculosis, and we send him into the doctor and say, doctor, I don't feel well. And the doctor asks him questions, and we're recording it secretly, okay? And then the doctor gives a diagnosis, and the doctor gives treatment. Let's just say that if your kid had diarrhea, don't take him to the doctor, because the probability of being hurt is higher than the probability of being helped. So it's very, very low. I'll go back later. So I don't think it was an issue on treating coronavirus. It's always an issue before and after COVID-19 on providing high quality healthcare for China's 800 million people.
Yeah, so that's it's fortuitous that COVID-19 did not spread widely in rural China, because if it had, then it would have been a bigger mess.
I actually had that on. I didn't say that. I think that's a really good point. I'm glad you made that point. So what would have happened in this area with,
Right. Okay, so we have a question from Australia, actually, which also dovetail with one of my own. What was the impact of this COVID-related lockdown on farming production and sales of agricultural output?
Okay, so again, I think China was mostly fortunate that it happened in the winter. Okay, and in all of those provinces, we actually had a pilot test on everyone, and even in March, our March survey, nobody was going to plant until early the next month in anywhere except Yunnan. So we're actually redoing in April. We ask about planting everywhere. Guess what, right? I mean, they didn't get any food because they lost their job, but they're getting quite big subsidies to help them plant crops right now. So they're getting fertilizer subsidies, seed subsidies, and they're being encouraged to go do that. Now, the good news is there's a lot of people there to work hard on agriculture now because there's so many people unemployed. The bad news is most of any worker who's under 35 years or younger, and that's most of these unemployed, guess what? They don't know how to farm. They've never farmed in their life. So, but I think the fact is you see the bias of the government policy in that, now they're worried about, is China going to have enough food for the whole population? Wow, we'll go subsidize that. And they're putting a lot of effort. It's going to help the farmers. So, it's not going to hurt the farmers. The real ultimate objective, of course, is food security for all, right?
Okay, so there's an interesting question from one of our students. Did the survey cover anything about the stay-at-home migrant workers' thoughts on their future livelihood? It pushes them to reflect on having their livelihood entirely reliant on urban employment, which can be relatively unstable compared to agricultural, especially given these subsidies that you talked about.
Okay, so I have to cover up. So you don't know what phone company that we worked for, but when we worked for them, we were able to do a survey of their production line workers, and we asked them a question. This is about 3 years ago, but I think it's still relevant. We asked these workers, where are you going to be 10 years from now? Okay, and what are you going to be doing? What are you going to be doing 10 years from now? Okay, here you go. 20,000 workers, we asked that, okay? 1% said, I'm going to go farm. 1%. You know, I mean, the fact is if you look at farming today, so let's say dad farms and the son is working in a factory, right? The son makes in 3 weeks what dad makes on the farm all year, right? This guy's never going to, the son's never going to farm, right? Okay, so 1%. Okay, here we go. 10% said, I'm going to still be working in a factory. You know, people don't like working in factories. It's hard work, but some people will still be working in factories, right? Yeah, that's not to say the factories won't be automated by then, or the factory jobs may move to Bangladesh or Ethiopia, right? Or Vietnam, but that's what they said, right? This is their objective. Okay, 1% said, I'm going to work in a white collar job. Okay, I have enough education that I can go work for an accountant, for a banker, or, you know, something like that, a hotel manager. Okay. How about the other 88%? Gutihu. I'm going to work as a small self-employed worker. That's what, you know, that's what they say they want to do. Okay. Now, the reason we asked these workers there is we were trying to keep them there to reduce turnover in their factories. And so we thought, wow, all these guys want to go be self-employed businessmen. Why don't we offer them night courses in business law and finance, accounting and management and blah, 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 right? And we will give them, and guess what? Guess what? We offered 5,000 people positions in these projects. Wow. After 1 week, 4,500 came. Really interest. After 3 weeks, no one came because they don't know math. They don't know language. They don't know science. They don't know how to do, and they can't focus on reading the text and the manuscripts, right? So these guys aren't going to be, you know, savvy, high-tech startups, right? I think that this is rural China. No, sorry, this is China's absolute, their challenge is there are, 600 million people in this urban, rural labor force, and 70% of them have never been to high school. Okay. What do they do in a high income, high tech, modern, high wage economy? I think that there's lots and lots of problems to go. I always say one possibility is look south from where you guys live and see what's happened since Mexico lost all their maquiladoras in the 80s. They lost them to China, right? They haven't grown since 1990, and look at the informal labor force, right? So that's another seminar too.
Well, yeah, so that's an issue that's shared by many parts of the world, and of course, including the United States.
But I think it's included in China.
Including China, of course.
China has the lowest level of human capital in the entire middle income world. Right. The lowest level. They have fewer share of their labor force has a high school education than South Africa or Turkey or Mexico. So
the variance is also extremely high, right?
There's lots of smart people. Yes, we know that, right?
Stanford.
All of my collaborators are extremely high quality, right?
Right. So there's a good question. So who were the people who enforced the lockdown at the village level? I mean, presumably the village party secretary is only one person, so you actually need a lot of other people to have a 24-hour,
Yeah, it's actually great. You know what? We added that to the April question, and I was very interested in that. Some other people have asked about that. So, so basically, it's the party leadership, who is this township representative, the elected, it's elected by the elected party secretary / village leader. And then usually the accountant is like the deputy leader. they're the leadership committee. There's also a party, right? So typically in a village, it's probably 3%, but it's 3% of 1,000. So there's 30 party members. And so that's typically what they did is they selected a group of militia. I call them militia. And they, gave them masks, N95 masks, and they gave them sticks. And we then asked, was there any violence? Was there any? And the fact was there wasn't a lot, right? Every once in a while I said, that old man wouldn't stay home. And so I finally had to whack him in the butt. That was a quote. But, we asked, at least the village informants didn't say that there was a lot of overt violence. It usually was, we made them go home and we threatened that we would lock them away if they kept coming out. But that's who it was. So it was the local party, or it was other people selected by the village committee. They got to go out of their house and, have the temperature check and sit all night at the, I don't think it was a very fun job, especially as the middle of winter.
Also not fun in urban China.
Yeah, I saw those, exactly.
Question from your colleague, Yi Qing, former colleague. So the informal social safety net seems to work reasonably well for the migrant workers back in 2008. And also maybe this time, have you seen major changes in the ability of rural households to support migrant workers who are unemployed 11 years later? So similar to my question, but do you have data from 2008 in terms of whether rural household had to reduce their food intake and all this?
Yeah, it's very, no, we did a very large scale survey on reduction of employment and then revival of employment. We did a 2008 December survey, and then we did a December 2009 September survey, and it was incredible. Huge fall off in unemployment, and then virtually everybody is back to work by the next September. Yeah, I wish we would had asked those same questions. I don't know how people were poorer then. Much poorer, right? And I'm sure there was a lot of belt tightening. What you worry about now is that the ties within the village are less secure, and because that's who gives you, as you saw, you went and borrowed money from relatives. I think we're planning as soon as we can do surveys in the village face to face with individual families. We need to get that kind of history, right? Maybe not back to 2008, but we need to document it for now and see how exactly families choose. So I'm very interested in that. And I Ching, let's do it together, okay? Victor, you want to help?
If I don't know anything about rural China, but I'm happy to, so unfortunately we're out of time. Thank you so much for joining us today. I learned so much, and I'm always a huge fan of your work, and I will continue to read your latest research. So just before we depart today, just a quick reminder that we have a couple of additional events. Monday, June 1st, please join us with Yuan Ang from University of Michigan, who's going to talk about her new book, which is called China's Gilded Age, The Paradox of Economic Boom and Vast Corruption. So that I'm sure we can squeeze COVID-19 in there somewhere. Also, quickly thereafter, on June 3rd, we're going to have Qinhuan Li, the noted sociologist, joining us and look at the 1-year anniversary of Hong Kong's anti-extradition movement, the breakthroughs already achieved, and the latest crackdown during the COVID-19 pandemic, and the challenges ahead. So also COVID-19 related in some sense. So please join us for those events. And we're trying to keep the 21st Century China Center very active in the middle of this lockdown. And thank you all of us for being such fans of our events and joining us in such large number. And we look forward to seeing you again next time. Thank you.